Which of the following is the most likely complication of this patient's condition? Cardiac tamponade, pneumothorax, pulmonary embolism, saddle embolus, or stroke? A 45-year-old man presents to the emergency department with severe tearing chest pain radiating to his back. He has a poorly controlled hypertension, a poor history of hypertension. His blood pressure is 200 over 120, and his heart rate is 110 beats per minute. A chest X-ray shows a widened mediastinum, and an ECG reveals no signs of ischemia. Further imaging shows shows dissection involving the ascending aorta. Which of the following is most likely complication of this patient's condition? So, okay. When I see levels like super, super, super high of blood pressure, my mind just goes to stroke. Like that's like what I think of first. I don't think of like no, because cardiac tamponade would like the first thing with cardiac tamponade is like hypotension, and so that's not going to be seen here. So I'm going to get rid of cardiac tamponade.
So,
Pneumothorax, I think
so
of
talk to me
more like
about this real quick before we get tunnel vision a little bit. I'm going to backtrack you before and kind of give you a different perspective here because I feel kind of the route that you're going. So 45 younger male, right?
mhm,
Acute issue, severe tearing chest pain rating to your back. That's very, very symptomatic of aortic
dissection.
dissection
Yes.
already, right? And one of the risk factor for aortic dissection is high blood pressure, which he does, right? And then they say widened mediastinum, and then no ischemia on ECG, but then they did a imaging and they gave you your diagnosis, right? Which is aortic dissection involving the ascending aorta. Now they're saying, what is the most likely complication of aortic dissection? So now, right, to reword it, right, they already gave you your diagnosis. So you have to pick one of these that can be seen with aortic dissection. Does it make sense?
Yes.
Okay, so now kind of work your way with that. So talk to me about the anatomical. What is an aortic dissection?
It's when you have like a tearing of the intima of the aorta, and it starts to divide a little bit. I'm thinking more of like a rupture of some sort, or maybe like an aneurysm is what I'm thinking.
So
That's
if you
like
take a look at my badly drawn heart here. Okay, if this is your left ventricle, you have your aorta, right? That kind of goes like this.
mhm.
Okay, like you said, when you have an aortic dissection, right? It's like kind of this path that shouldn't be there, right? Well, it says actually the ascending aorta, right? So the path is kind of somewhere right here, right? Where you have this kind of like the blood tears through the intima and kind of like is kind of somewhat contained here, right? For now, right? Before it blows up completely, then you just have this huge leak in the pipe, right? So all this blood is pulling, it should be in the lumen, but now is like being dissected through the wall here. And then obviously this gets very, very thin where it can blow out. But before it blows out, right?
It can fill up the
Or
yeah.
yeah, so then now your question is now anatomically, what do you think this kind of issue can cause?
It can fill up maybe the pericardial sac.
Okay, cool. So you want to go with that?
Yeah, I'll probably go with that.
Make sense?
Yeah.
Okay,
Hmm.
so you want to work through things on, I think I get where you're coming from, right? I get where you're coming from when you're looking at these high blood pressures, et cetera, right? But one of the key things for this question, I would say, is that they've already given you your diagnosis, right? So I know this is one of the rare chances, right? Don't ever repeat me for another question, but rare chances we're saying like, okay, so you have your diagnosis, right? Your diagnosis.
Mhm.
Okay. So if you have your diagnosis and they're now asking what's the complication, so you got to ask yourself, what are some complications from this, right? So the rest of the question doesn't really matter. Does it make sense?
Yeah, makes sense.
Okay. So now in your mind, you're like, okay, so if you understand what aortic dissection is, right, it can cause, cardiac tamponade, it can cause like regurgitation, it can cause things with the heart, right? Because it's so close to the heart, right? Can't cause a pneumothorax, right? It's not going to deal with the lungs. It's not going to cause pulmonary embolism. It has nothing to do with clots. Same thing. Pulmonary embolism and saddle embolus, right? They're just extensions of each other, right? A really
Yeah.
bad pulmonary embolism is a saddle embolus. Can't be both the answer, right? And stroke. Well, yeah, I mean, if you relate it back to the blood pressure, yeah, that can increase your risk of stroke. But they're talking specifically with aortic dissection, right? In theory, right? I mean, if you extend this four jumps of logic down, if you have a blowout of your carotid, right? Of course, you're going to stroke out because you have no blood to your brain, but that's like really far down the line, right? They're talking
Yeah,
about immediate complication, right?
and plus
So,
it's ascending aorta, can definitely, yeah, makes sense.
make
Makes
sense?
sense.
Perfect.